In 30 days, you could move like this again. In 30 days, you could feel significantly better when walking, climbing stairs, or getting out of a chair, but only if you stop making this common mistake. And many people with knee pain make this mistake every day, often believing they are actually protecting their knee. But before the end of this video, you will understand what this mistake is and what you should pay attention to instead. Knee pain and daily movement. If your knees hurt every time you stand up, climb stairs, or walk for a long time, you may believe the only solution is rest. You may stop taking the stairs, walk less, or avoid exercise altogether. And sometimes temporarily reducing activity may be appropriate depending on the cause of your pain. But complete rest is often not the answer. When you move less because your knee hurts, the muscles around the knee may gradually become weaker. And when those muscles become weak, everyday movements can place more stress on the joint and become more difficult. This can create a cycle of pain, less movement, weakness, and even more difficulty with daily activities. So what should you do instead? That depends on understanding how your knee works. Your knee is part of a complete system. Your knee is not just a single structure. It works together with your muscles, tendons, ligaments, hip, ankle, and body weight. Every time you walk, stand up, climb stairs, or squat, different parts of your lower limb work together. When the muscles around the knee become weak, everyday movements can place more stress on the joint, but the pain may not always tell the complete story. The first step is to identify what is actually causing your pain. Is it an injury, arthritis, overuse, muscle weakness, or a problem coming from your hip or lower back? The solution depends on the cause, and this is important because the same knee pain can have different causes and may require a different approach. The common mistake. A common mistake is forcing painful exercises because someone online said they are good for the knees. But your knee may not have the same problem as the person demonstrating the exercise. You may have a different injury, a different level of strength, or a different reason for your pain. So an exercise that is appropriate for one person may be too aggressive for another. The goal should not be to force yourself through the hardest exercise. The better question is, what movement can I perform safely and with control at my current level? And this brings us back to the mistake mentioned at the beginning. Pain is a signal. Pain is a signal, not something you should always ignore. But that does not mean every sensation requires complete rest. Pay attention to the pattern. What movement causes your pain? Does it get worse as you continue? Does swelling develop? Does your knee feel unstable? If a particular exercise repeatedly causes sharp pain and your symptoms become worse afterward, the exercise or the amount of load may be too much for you. Start with controlled, pain-free movement that your body can tolerate and gradually improve your strength and mobility. The exact exercise depends on the cause of your knee pain. Your action today. Your action today is simple. Pay attention to which specific movement causes your pain. Does your knee hurt when you stand up from a chair, climb stairs, walk for a long time, squat, or run? There's a big difference between saying, "My knee hurts," and saying, "My knee hurts when I climb stairs or after walking for a certain period." That specific pattern gives you much more useful information. You do not need to diagnose yourself, but observing the pattern can help you understand what your knee is having difficulty tolerating. When should you seek medical evaluation? If your knee is swollen, locking, repeatedly giving way, or you cannot bear weight, you should seek a proper medical evaluation. These symptoms may require a more complete assessment before you continue experimenting with exercises on your own. The same symptom, knee pain, can have different causes, and different causes may require a different approach. Now, let's return to the promise from the beginning. In 30 days, you could feel significantly better when walking, climbing stairs, or getting out of a chair, but only if you stop making this common mistake. The mistake is not simply exercising, and it's not simply resting. The mistake is forcing painful exercises or treating your knee pain without understanding what your knee is actually struggling with. Instead, pay attention to the specific movement that triggers your pain. Start with controlled movement that matches your current ability, then gradually improve your strength and mobility. And remember, your knee is part of a complete movement system. Comment "keen" if you want more evidence-based knee pain videos.